spend the next half an hour looking at medical technologies, emerging medical technologies. Although there are lots of ways in which embedded systems have impacted us, I wanted to spend this time thinking about the human side, because what inspires us to innovate? The people we love and care. And so that the medical edge, it is the last few years and the coming years are transforming the medical field by the embedded systems that we have built. And so I want to sit back and see what future we can develop. I do hope that from this event, from this room, the new innovations will be created from the minds that are there in this room. So I will talk about imaging and diagnostics, how they have become much more portable now than they ever were, how the quality of imaging is better than it ever was. Also, monitoring. Monitoring is changed. The way we used to monitor has drastically changed by embedded systems. I will talk about heart, blood, etc. The other big advantage that embedded systems have been able to bring in, usher in, is the remote care. So every part of the world, whether there is a doctor or not, we are able to provide remote care. Not only is it available to everyone, it's even cheaper than it otherwise would have been available. Isn't that nice? The next part, in the body, I call it in the body because embedded systems are embedded in so many different places. That's why we call them embedded. But here we'll talk about embedded in our human body. I think that's the ultimate innovation that we as human beings have made and are on the crux of making. In the body, inside our bodies, outside our bodies, how they are changing our life. How they are assisting doctors. By assisting doctors, even doctors are the greatest minds that work on human body. We put our lives in their hands. Their accuracy of their work is of ultimate importance, and we are using embedded systems to assist doctors. And then lastly, I would like to close with some advanced research that we are doing. How we are emulating human organs. So yeah, we emulate operating system, we emulate hardware, we emulate this. Now we are emulating human organs in the lab. So I thought that was so exciting, and I want to end with that note today. So let's talk about imaging and diagnostics. So this is eye exams, the ophthalmic exams. We used to be in the doctor's office. But now we can use a smartphone to do that. And this technology is called PEEK technology. It's a portable eye exam kit. And it consists of what? A smartphone, of course, a mobile app, and some other hardware that is needed. And using this, mobile exams can be done. People can scan. The phone itself is used to shine a bright light and go deep inside the eye. Glasses prescription can be checked. Visual acuity can be checked. Color vision can be checked. Contrast sensitivity. And it can be used to even diagnose cataracts and examine the back of the eye. So how powerful is it that anybody in the world who has access to smartphone can use of this technology, regardless of there is a helmet just with you or not. This is another application of imaging, and it is about smartphone. Using smartphone, a lot of these technologies, smartphone, we can't live without smartphones anymore, right? We have them in our hands, at least one, if not more. So if we can use them to do all these things, it's great. Imaging. So we're talking about imaging where we do ultrasound imaging with the smartphone. And the leads that you see on the right side, that probe is the probe that any of us who's had ultrasound knows is used to create, is covered with transducer that's used to take the ultrasound and bring out the images. This used to be in a doctor's office, but now, or in a medical facility, but now it's connected with the smartphone and is sold as and this is Mobile's Handtake is the company that has brought it out, and it is called the Mobius SP1. Mobi because it's mobile. So what are the things that can we do? We can do ultrasound exam using the smartphone and that probe, the endocavity probe that we talked about. We can save and review the images Of course, to review the images, it's a medical technologist who does it. You and I can't review or understand or make anything about it. But for the ultrasound examiner, you don't have to go to the facility, but using a smartphone and this probe, you can do all the routine screening for bladder measurements, let's say, or even sometimes when in a certain kind of OB gynecologist, obstetric and gynecologist, there are certain kind of infertility treatments that are done, and as they are done, the patients have to be monitored, and so this gives you ability to monitor the uterus and the ovaries during the whole treatment. So how powerful is it that embedded systems have brought this kind of technology in the palm of our hand without any need to visit doctors? This is another one, a portable. So portability, ultrasound imaging, portability, cheap, high quality. So this is actually a Doppler system for sonography. What you see there is a tablet or a laptop, and there is a probe next to it. And this allows us to do ultrasound exam for various high quality, high imaging sensitive things. So for example, if you want to say liver dimensions and the blood flow, you can use this system for that sonography. It is called S2 and it is from Sonoscope. It's called the portable ultrasound imaging. Even you can detect heart diseases with this portable kit. Thyroid gland to see the ganglions, whether there is any growth of ganglions in the thyroid glands. Pancreatic gland, that's another thing. Homogeneity of the pancreatic gland. Because when one of the first signs of cancer in pancreas is that the homogeneity of the gland starts changing. So when you see some foreign things there looking different, then you know what is going on with it. Imagine having that power so portable and available to people as a part of their routine exam. So this is, we were talking about the portability, the quality of exam. This takes that to the next level, 4D, four-dimensional imaging. So what is four-dimensional imaging? It's three-dimensional imaging carried with fourth dimension as the time. So when you can see 3D images over time, it is great power because everybody is different. If somebody takes a snapshot of one person, it just becomes a baseline. Then you have to wait over time. So many times when doctors are trying to diagnose some problem, they ask you, do you have an earlier EKG? Do you have an earlier ultrasound or a mammogram? So that's because there has to be a baseline which is different for different people. Therefore, it becomes of ultimate importance to figure out how does the image change with time. It also becomes important to have the ability to superimpose different from different places. So this picture that you see is the image of a fetus, and it's a 24-week fetus. So for a pregnant woman, one example is, suppose a woman has a baby that is very big as compared to the number of weeks that have happened. It is a sign that the mother has diabetes or will develop diabetes, or the child can develop diabetes. So this is a very serious matter. Therefore, it becomes important to be able to see medical images, 3D medical images with time as the fourth dimension. So what you see here is a 24-week fetus, and the machine by which this is happening is a 3D ultrasound machine. And what it does is it uses different images. So how does this machine put together that data? It's a process called fusion. It is able to correlate. So you can have ultrasound, and you can have an MRI, and you can have a mammogram, and you can have different studies, and you can correlate them on the same timeline, on the same dimension. So you are able to see what happens with each of those parameters and do a very specific medical evaluation. It not only that fusion process will align images that are captured by different devices and also by the same device on different timings. So that's the beauty of the system. One big thing about it is it eliminates false positives. It eliminates false negatives. One of the biggest problems that we found is that as number of mammograms, our sensitivity and our acceptance and our habit of getting routine exams has grown. And that's very good because it's now part of our culture. We don't go to a doctor when we are sick, we go to the doctor when we are well, so that he can tell us before time when we are getting sick. That's very, very good. But what is the downside? Because we do all these tests, sometimes we end up with false positive because machines are not perfect. One area where that happens very much is mammogram. When you take a mammogram image, you have many weird, strange looking things. And then the doctor has to do invasive things, means invade inside the body and look at do a biopsy, take out a culture, and then come up and say, oh, by the way, you don't have cancer, that's good news. But the bad news is we did this mini surgery on you. So that is a false positive. This helps with that. In traditional mammogram, that has been a big problem, and this helps with that because of the way it gathers data. Oh, this is another good thing, flu, right? Diagnosing the flu. The best treatment, traditional flu treatment that we have is you take the sample, go into lab, takes a long time, come up with a diagnosis. This is at the site. You can take a microfluid chip. What you're seeing here is a blown up image of a microfluid chip. And it is, I wish I can remove this. So this is has been created at Boston University, and the purpose of that chip is to detect influenza. And the method by which it detects is very exciting too. How does it do that? Not the traditional way. So first it takes the first column, it takes the protein, the signature protein for the sample, and extracts RNA from that. Once it extracts RNA, there is the middle chamber where it converts the RNA to the DNA. And in the third chamber, we replicate the DNA in sufficient quantities. Once we replicate the DNA, we have a large enough sample to be detected by an external reader. So it kind of takes a small sample, blows it up into bigger sample, and is able to then read by an external reader to see if it is a flu or not. Very powerful, I think. So let's talk about monitoring. So this is very exciting. Anybody here who has had a diabetic for a family member, for a loved one, for a friend, knows what a pain it is to get blood tests all the time, right? And not only that, you have to prick your finger, you have to take out blood, you have to do it very often. You just can't keep up with it because you take it 2 times a day, 3 times a day, 12 times a day. How many times you take impacts how well you manage diabetes. However, just imagine having to keep pricking your fingers all day. It is a pain for a diabetic to do that. And the better we get with the monitoring, the better we will deliver the insulin dose to that person, the better will be his level of control over a period of time, the longer will his life be. So it is very powerful, very important to do innovation in that area of blood sugar testing. There are 2 good things that are happening. One of them is, this is a test tube. So it tests glucose, but it doesn't prick your finger. It is clipped onto your earlobe. So what you see there is something that clips onto the earlobe, and it does testing. So every time you do one test, it tests it. So it's still a discrete test that happens when you do it, but instead of pricking your finger, you can do it as a earlobe. And it's glucose track. And it is non-invasive glucose testing. Non-invasive because you don't have to prick your fingers with it. And it helps them to do the blood test without the pain of needles. So the personal ear clip that is needed, and the result is sent to the main unit. And also for some people who may be challenged to see, it speaks it out, that your reading is 128. So tomorrow When you see these devices in market, you should be able to say, we saw it first here. So this is again a different take on glucose monitoring. So I remember I said it's important to take as many samples as possible so that we know exactly how much is happening. So rather than taking one test or two tests, a continuous monitoring is very important. So this is again a non-invasive way, but it is a continuous monitoring. Rather than single tests, it's a so you put this thing on, it's like a patch. Again, it's by Aquatherapeutic Symphony, and it is non-invasive, and it is wireless. So it is talking to somebody, but those biosensors are right there. So it's a permeation device. So it has biosensors. It is almost like a band-aid that sticks onto you, but it doesn't prick you. It doesn't create. It's not like a needle that goes into your skin, but rather with the biosensors, it can find the glucose level and wirelessly transmit it to an external unit from which you can study it continuously over a period of time and do different things with it. So imagine the power. What is the difference between a normal person who doesn't have diabetic and a diabetic? The normal person's pancreas works okay, and a diabetic's pancreas doesn't work okay. So pancreas is what always sees how much sugar is there and produces the corresponding amount of insulin. But for a diabetic, that decision has to be made externally. So the diabetic person, we have to see how much is the level of sugar in the body and accordingly deliver insulin. Imagine our ability to, so this is almost as good as nature made it. God-made pancreas has the ability to forever monitor, and with this device we reach that finesse of almost always continuously monitoring. Another big thing is, if you are hyperglycemic or hypoglycemic, means go above and below the range, it will immediately alert. So the long-term effect, many people die in their sleep because, many diabetics die in their sleep because they never knew that the body went into hypoglycemia. They were not discovered in time. They don't wake up, pass out. So that all those are avoided by this device. The other one is blood pressure monitoring, and this is a cuffless device. So we have, what is the beauty of this? When we put a cuff, we put a cuff to measure blood pressure. We are only measuring at that point in time. By putting this device, which is CNIBP, continuous non-invasive monitoring, Sotera virus has produced that. The blood pressure is monitored on a regular basis. It's not that today I took it in the morning and then I'll take it again in the evening, or I'll take it before I take the blood pressure medicine. So not only that, because it is, so the catheters, it uses a catheter. This is an improvement upon a catheter. So today what happens is either you can do a cuff and get discrete values, or you can insert a catheter into the body so that you continuously get glucose. This doesn't require a catheter because it's non-invasive, but still has the benefit like a catheter because it takes continuous values and wirelessly sends a notification. So that's another very exciting thing that is happening using embedded system. Let's talk about the remote care. Why is remote care important? Because it gives people, you're not tied to hospitals. You're not tied, just because you're sick, you don't have to be in a hospital. Just because you're sick, you don't have to be in doctor's office. One should be able to live life as they would, even without, whether you're sick or not, or whether you just had a surgery or not. So that is the big thrust. So here we have the picture that you see is by Haiti, where we have embedded medical technology systems, and this is like a real-time patient monitoring. And what it does is it goes to the point of care. Wherever you are, that's where this monitoring is done. It's very portable and cost-effective and allows you to lead your normal life. And it continuously, depends on how we program it, can run diagnostic on the patient. And what happens when it does that? It informs the doctor. Our doctor can see from wherever the doctor is, from the other part of the world for all you care, and is able to diagnose and see what is going on with the patient. And as it monitors in real time, somebody is able to notify if anything is abnormal, anything is not right, then the notification is sent. The other, from a technology perspective, good thing about this design is it's a fanless design. It doesn't have a fan. So the power usage is of course less, it is not noisy, but more important than that, there is a lot of fan spreads airborne bacteria, and this prevents spreading of airborne bacteria. So now talk about in the body, what happens inside the body. Let's talk about some of the when embedded systems are embedded inside our body. And that's very exciting because that's the ultimate that we can use embedded systems for. It's fun to use them in our cars, it's fun to use them in our aeroplanes, it's fun to use them in different testing tools, but I think it is ultimate creativity to have them inside our body, or on us. So what is this? I wanted to talk about microstent. Eventually, microstent. What is that? That is a quantum. And the thing, that eyelash thing that is on top of it, to give you the idea of scale. That's why this picture gives you an idea of how small it is as compared to the quarter. It's almost like an eyelash, shaped like an eyelash. And that is a stent that goes in your body. Microstent. Now, many people here are familiar with stent. Stent is something, if your heart is not pressing enough blood in your body, then you put a stent. And a stent creates that pressure and blocks off different parts of the blood vessel system and evens out the flow. And it is surgically inserted into the body and also inserted through a catheter. This takes that to the next level. That's why we call it a micro stent, because it's much smaller than a stent. And the bigger thing is, it's a device which is implanted in the eye. So it is used to treat glaucoma. So same, not the heart, step back to the eye. Glaucoma is a pressure, when pressure is built in the eye, then it creates disease like glaucoma. And they're very painful to disease. Some of them end up in blindness because some of them are quite untreatable. So microstent is implanted in the device for patients with glaucoma. And what does it do? It acts like a clamp, like it tightens a vessel. It's like putting a tight rubber band on something on a elastic tube, and that increases the water pressure. That makes the water pressure go up. So when we do that, the eye pressure increases when the eye channels are blocked. So this helps you increase the blockage. This helps you get rid or eliminate the blockage by putting this microstent appropriately, which is different for different people. So that once it is put in the eyes, then in the primary fluid canal, then that channel is opened up. And when it's opened up, it's like a plumbing system that has been fixed. So it's so natural. This is how the eye was supposed to work. And glaucoma is, the eye pressure is then fixed, which treats glaucoma. So this one is a necklace. It's something on the body, and it does ECG monitoring for heart patients. And it's an IMEC device. It measures a bipolar. So what you see on this necklace is it creates a bipolar ECG signal between two electrodes, and therefore as you go on with your life 24/7, it keeps checking and continuously works to see if there is any arrhythmia or any during stress. Are you under risk of developing epilepsy? So you know Douglas Adams, who was a big science fiction author. He was on the treadmill and he died on the treadmill doing exercise at the age of 42. And that was a big surprise because it happened a few years ago, and that has kind of increased awareness from the medical side as to when people are under stress. They are very different. Their hearts are functioning very differently. And we suddenly have to keep seeing what is happening to their hearts. So that is a step in the right direction to be able to monitor people's hearts and not have a collapse on the exercise machine or anything else that they're doing during the day. So let's talk about headaches, right? We all have had headaches. So we take aspirin. This is electronic aspirin, so to speak, an implant. So it's called a neurostimulator, and it's from ATI, which is Autonomic Technologies. So what does it do? So when there is headache, we automatically go press here, press there, we think it will go away, or press here, right? Because we stimulate, and we need some stimulation in certain parts of the brain, and that will fix the headache. So this is a neurostimulator, and what it does is it provides a low-level stimulation when we want it, not always. So this can be implanted for people who have a lot of migraines and they can't go on with their life because of the headache. This can be, it's a small incision in the upper gum. That's where it is planted inside the body. And then what happens is that it is close to the SPG. There is a SPG nerve bundle, which is considered thought to be the cause where if the stimulation is given, the headache will go away. And then what happens? When it is there, you forget about it, you go on with your life, you don't remember you have it. But when you have a headache, you have a remote controller in your hand, just like you remote control your TV, and you give yourself a little, pressing on the remote control, you can give a little stimulation when your headache happens. So it's called the electronic aspirin. Anything you think of is being done. Is done somewhere, right? And we have to do it. We have to keep thinking. So that's the whole idea of coming together, spending this time together is how do we change things? So pacemakers. So what is the problem with pacemakers? Anybody who's had a pacemaker in the family knows is, it has leads. And leads have infections, a lot of problems that come with leads. They can become fractured, they can be dislodged. So this nanostim pacemaker, so the one that you see on the top, the left and the right, is a nanostim. It's a pacemaker. It's a very small pacemaker. And the bottom that you see is the aortic. So what happens is that our heart needs a pacemaker to replace the wall. It has valves, and valves are necessary to keep the blood flowing through the body. Aortic valve sometimes breaks, and so pacemaker is kind of a substitute to the aortic valve. But the problem with the pacemaker is it doesn't happen because now you see that it is so small that it can be placed right within the heart. The older pacemakers are put somewhere else in the body, and then you run some leads to the heart. Now it's right there. You don't need any leads, and therefore it is a much safer pacemaker to have. And this pacemaker is from nanostim. So prosthetics, right? Prosthetics are very important for us to go on with our life. Reality is, prosthetic give you the ability, but it's not as flexible, it is not as smooth, it doesn't feel like it's a part of our body. Why? Because we can't talk to the prosthetic, we have to actually move it. If I had my leg replaced with a false leg, prosthetic leg, then it is through my body's movement, this is the traditional technology I'm talking about, that I would have to use it. So so that is different from the natural leg, because the natural leg listens to my mind and moves. I don't have to think when I move my left leg, because it's automatically moving with the thing. So the hypothetical situation that I was having, so we recognize, I want you to recognize the difference between natural limb and artificial limb is, artificial limbs don't listen to your mind, they listen to your body. And the normal limbs listen to your mind and do what you ask them to do with your mind. This is very important. It is from the Chalmers University researchers. It has been built, and what they do is, this is controlled by the brain. So this, what you see is an artificial arm which is controlled by the brain. So that's the ultimate progress, sign of progress with technology. And so what happens is the brain signals are in the mind. You think, oh, I want to move my arm, and they're transferred via the nerves, and you see that connection to the arm stump, and they're captured by the electrodes. And then they take the signal and they transplant it, and there is a titanium implant, and that's decoded by the arm. So basically, you think you want to move your arm and you actually move it. amazing how far we have come with the embedded system. What is even more amazing is how much farther we can go with it. So this is a heart valve by a transcatheter, minimally invasive. Again, it's a heart valve. I talked about the heart condition earlier in a different sense where we are talking about pacemaker. But this is a slightly different one. It is called a Satwant Kaur by Edwards, is the company that has built it. So if human heart works, we function because human heart can open, close to the blood flow. But when there is a narrowing of the walls, then the blood flow doesn't happen. Then normally we do open heart surgery to replace the wall. But that has now been improved, and patients have a better option to use a transcatheter aortic valve replacement. And what does that is, you can actually have a valve, but you put it somewhere else, maybe in your thigh or your arm, and you use a catheter to bring it to the brain. So if somebody is very sick, cannot stand to get his heart opened up, this is a very safe way to do. Don't have to do open heart surgery, but do a valve replacement through a transcatheter, minimally invasive. So let's see how doctors can be assisted. So we know that doctors can perform therapies, and they do on a daily basis when they save our lives. So, but if they can be assisted with using technology to provide the accuracy and the information that they need to make the right decisions, it's great. Google Glass is one of the technologies that help the medical field in a big way. So, as you can see, the doctor is wearing Google Glass, and they can access data with the help. So, by wearing the glass, they're looking at the patient. They don't have to go look at somewhere else, but they know the actual history of the patient, can access the data about the patient, can see what allergy he might have. Maybe they might be performing surgery on the person, and the person is unconscious, can't even reply, but you have to immediately know, does he have any contraindication, or what was it, why do I see this abnormal behavior, did he have another surgery in the past? So that is important. You can find out data about the patient. The other important thing by which Google Glass is very powerful in aiding doctors is that they can actually communicate with other doctors and get their advice using Google Glass. They can see information in real time. It's right there looking through your glass. So, and also it can be used as a teaching tool. Robotic surgeon is another way by which doctors can be assisted by embedded systems. Here what we see is a Da Vinci robo. Da Vinci robo is by intuitive surgical, and this enables the surgeon to do, as you can see, with very few incisions. So the process, the whole, you would have heard me say over and over again, minimally invasive. Although we are pushing the boundaries, we are going to put embedded systems inside you, but we want to be minimally invasive so that we can better control technology for the benefit of human beings. So very few incisions. So this is one of the good things about the Da Vinci robo is you can do the same process. How does that happen? Basically, it increases the vision. It is more precise because, of course, it's computers, and dexterity and control. So by using the controls in the Da Vinci system, we have a much better control and dexterity. Also, there is a console where the surgeon can sit. There is also a cart on which the patient lies down. And what you see there are robotic arms. It has robotic arms. It also has a 3D vision system. And the instruments are called endurist instruments. So using those instruments, a surgeon can perform much wider than they could without. One more is a robot that is remote presence. That if you were from remote, it's about bringing here to the doctor. Doctor can still help you if they are assisted by a robot. RP Vita is a remote presence robot by InTouch and iRobot combined. And it expands the use of doctor consult. So you can consult with the doctor where doctor may be on the other hemisphere of what you live on Earth. It eliminates the need for telemedicine. So it's as if you're talking to them. And there is a control station application that's needed by which you can access this, the doctor can access this from anywhere. So the doctor needs a smartphone in his hand. So wherever this robot is, which may be close to the large patient facility, it's as if you're talking to your own. So that's exciting. So I would like to close with two big things. And I promised you that would be my last song of the day. And that's how can we simulate? This is exciting. If we can simulate human organs in lab, that's the ultimate. We understand them, we can simulate them rather than giving a person, how many times we go to the doctor, oh, you have this problem, try this medicine. If it doesn't work, come back to me in a month and we'll see what else to do. You don't have to do that because your organs are there and all the testing is being done. So what is this? This is a liver tissue. And how do we generate liver tissue? By bioprinting. So it's 3D printing platform basically. And the company that does this is Novagen. And they have a bioprinting platform by which you can generate liver tissue prototype. So what is the problem with the liver tissue? Liver tissue likes to grow inside your body. And once you take it outside your body, it stops growing. And that is the problem with the liver tissue. So all the experimentation and trials that has to be done has to be inside your body. But it grows very fast. So what bioprinting does is it reproduces the native liver tissue and it creates a biotissue which has the same architectural feature of the native tissue that you have. So it takes a sample out of your body and basically has the ability to replicate it using bioprinting. So what happens is that it took your liver tissue and it wants to see what happens if we replace this organ, will your liver accept it? It can see it outside. And all kind of tests, all kind of scenarios and decisions that have to be made can be done based on that. And the second one is this is gut on the chip, because intestine is one of the big things. A lot of our body functions are related to intestine. So this puts your gut on the chip. It's from Harvard, and what it does is it's a silicone polymer device, and it is lined by human intestine, epithelium from human intestine. And this simulates the movement of the food as it goes through the digestive tract. And therefore, it helps you mimics different features. For example, Crohn's disease is one thing which this can go a long way in helping in improving. Thank you so much.